And how much training is involved per physician when a physician who doesn't have any experience with any previous EHR starts using your software?
Well, it depends on the module. Day one, 20 minutes just to get them live and never looking at a paper chart again. And then they'll go into lab management and order management and messaging and e-prescribing. And each of those will be another 20 minutes, a half hour, as they're ready to go to different modules. But the first day, we like to get them on a dry run the night before or even a half hour before they start seeing patients just to get them comfortable with the software. And then they're off and running for that first day. And they never look at paper charts again.
Now, you spoke a few minutes earlier about clicking in order to produce the chart. And so obviously there's a variety of ways of producing a chart. You can handwrite it, you can type it, you can click through it. One of my favorite ways is to use speech recognition. There's handwriting recognition. Do you have preferences as far as the physicians are concerned as to how they would produce it? Do you still have any patients, the old family physicians, who handwrite a note? Is that compatible with your software?
We have doctors that handwrite, and that's more popular in primary care,
right.
Family physicians, and ophthalmology. Orthopedics, I'm sure when you were practicing orthopedic surgeon, you dictated.
Yes.
Orthopedics dictate, and most specialists dictate. Cardiologists, for the most part, dictate. So we allow for handwriting onto the barcoded forms, dictation, a hybrid, not why we're called a hybrid EMR, but where you have a form that comes up on the screen and they could do some drop downs for some very basic type of exams and integrate very tightly with Dragon Medical version 10 to save them on transcription costs and just have immediate results, be able to dictate and have a complete note. So we'll support many different ways. But what we do find is templating, like my brother, he'll template, he does consult letters for 95% of his patients. He'll template 50 to 60%, depending on the day, of his exams, because the simple exams are easy to template the letter. It's when you get that high pathology patient that walks in, that's where a templated system breaks down. And that's where an EMR that's reliant on point-and-click data entry and structured entry for every note, that's where it breaks down. So we take an approach where if it's simple and templatable, let's say someone comes in with rotator cuff tendonitis, and it's just a basic, you made a couple little orders, and it's kind of a basic exam template. We have a lot of doctors that will use that template. If someone comes in from a car wreck, and they have multiple problems, broken bones, you can't template that exam. So that's where they'll revert back to dictating.
And if I understand, someone can dictate, a physician can dictate, and as you know, I'm involved in Dragon Medical, and I need to state that. They can use Dragon Medical to get the document completed at that moment, or they could also use a digital recorder or a telephone and have a transcriptionist type it and put the transcribed note back into the proper place in the chart?
Yeah, actually we have a lot of practices where they'll have a Citrix server farm and the transcriptionists are off-site and they dial or connect right in through Citrix server or terminal server right into the chart and type in the note, click a button, and it sends it to the doctor's inbox for approval. So there's no filing, and that's part of the automation we were talking about. Or we interface with a myriad of transcription services where the doctor will dictate a slate of patients for the day, and then automatically those 50, 60 exam notes for the day will automatically be filed away and routed to the correct inbox for digital sign-off, or just filed away, dictated, not read, filed away.
I've seen that expression. Now, what happens if a physician wants to dictate the history, for instance, and then use some of the templates for some of the easier to template parts of the chart? Then they get to the assessment, the plan, and they want to talk it again. Is the transcriptionist able to put portions of the note into the various components of the SOAP note, if you will?
Absolutely.
And how does that work?
When they pull up the template, the parts of the note that have been dictated, either you do drag in and you go right to the spot, there's bookmarks, so you go right to the field and you dictate, or the transcriptionist will just type in those sections on the document, and then it's saved in the chart automatically.
Will the transcriptionist be looking at the completed note, including the drop-down click and
Correct. They'll be looking at that shell with the drop down and click.
And just putting in their portion.
Correct.